Hey, good evening, everyone. I'm Dr. Sandeep Singh, and today I'll be talking about shoulder arthroscopy. So, as we all know, arthroscopy is a relatively new and upcoming branch of the in orthopedics, where all the surgeries are done by a minimally invasive technique, where the blood loss is less, the incision is less, the hospital stay is less. Okay, and the patient's rehabilitation is much more faster. So basically, it's a surgical technique in which a tube-like structure is inserted into a joint to inspect, diagnose, and treat. And it is most commonly performed in patients with diseases of the knee, shoulder, elbow, wrist, and ankle. So till date, arthroscopy was most common in the knee joint. In fact, it started as a procedure for the knee joint, and then gradually we have mastered, and people are started doing shoulders, elbow, wrist, and ankle. So basically, arthroscopy is much more successful and much more easier in larger joints like knee joint and the shoulder joint. In the smaller joints like elbow, wrist, and ankle, uh, there are a lot of limitations, and the procedure is not of much use, I'll say. Open surgeries are much more preferred in these joints. However, in knee and shoulder, now we are slowly moving from open surgeries to arthroscopic surgeries. As it enumerated, there are so many advantages of arthroscopic procedure. The incision is much more smaller, the bleeding is much more less. Okay, the damage to the soft tissues due to the surgical procedure itself is much more less. Your stay is less. Okay, and the patient rehabilitation is much more faster. Patient compliance is much better. His confidence improvement takes in a faster way. So going to the history, the first ever use of arthroscopy was performed in 1918. Okay, so more than 100 years from now, by Dr. Kenji Takagi, who was a Japanese orthopedic surgeon. And this procedure, obviously, it was first performed in a cadaveric knee. And when he was sure, he was confident enough, then gradually we shifted to live patients. And similarly, the first shoulder arthroscopy was done by an American surgeon in 1931. His name was Michael Berman, and again, he first started by using it in a cadaveric shoulder. Okay, he first examined 25 shoulders. He studied the structures. He gained his confidence. Uh, improved his techniques. Okay, and then we all know now in shoulder we are doing not only diagnostic as well as therapeutic procedure also. A number of procedures, number of treatments for a number of pathological lesions of the shoulder joint is now being treated by shoulder arthroscopy. So, what are the indications for doing a shoulder arthroscopy? Well, first of all, either it can be a diagnostic arthroscopy or it can be a therapeutic arthroscopy. Diagnostic arthroscopy is one where we put in an arthroscope, we visualize all the structures, and basically we are trying to find out our diagnosis. Our patient may come to us with a complaint of pain in the shoulder joints, swelling once in a while, and but on our clinical examination and even by our investigations like MRI and CTs, we are not very sure where the pain is coming from. So in that case, arthroscope is introduced into the shoulder joint for a direct visualization of all the important structures in there. So basically, the glenoid, the humeral head, okay, all the various ligaments, the subacromial space, or we can directly visualize to identify the source of symptoms of the main pathological lesion inside the joint. Okay, another then on when we come to therapeutic indications, where it is very much commonly used to repair a slap lesion or a slap tear. So, what is a slap tear? Slap tear is a superior labral anterior to posterior rupture or a tear. Okay, here you can see in the diagram what it looks like. Okay, so in the superior part of it, if there's a detachment of the labrum from the articular surface, then it can give rise to pain for the patient. There may be limitation of the movements due to pain. Okay, and to repair this lesion, we just need to suture this. And to repair this lesion, we need not open the joint, whole of the joint as such. We can very well do it with an arthroscope. Shoulder joint is a very vascular joint. Okay, so in the shoulder joint, I mean, if you do an open surgery, a lot of bleeding takes place, and since it is a very vascular and a muscular region, a lot of fibrosis takes place after that. And the problem with the open surgeries was that even after the surgery, I mean, there was so much of fibrosis that there was patient used to complain of limitation of movements. Okay, the patient will come back, the pain might go, but he'll say, "Now I'm not able to move my hand in all the three, in all the directions." Okay, the range of motion is decreased if we do an open surgery and if there's a too much of fibrosis. So to overcome that, shoulder arthroscopy is being done now very widely. Okay, because as I told you, and the scarring is much less, and we do not lose the range of motion. Another indication may be repair of the Bankart lesion. So what's a Bankart lesion? Bankart lesion is a tear in the labrum in the inferior, anterior or the inferior part of the shoulder joint. Okay, and usually occurs with the anterior dislocation of the shoulder. Okay, so if that, and it may be sometimes associated with a Hill-Sachs lesion. So what is a Hill-Sachs lesion? A Hill-Sachs lesion is a fracture or dent in the posterior part of the humeral head. Okay, so you can very well imagine if there's an anterior dislocation of the shoulder or the humeral head, it may tear the labrum, giving to Bankart's lesion, or and may dent the posterior surface of the shoulder. I mean humeral head also. So the Bankart's lesion and Hill-Sachs lesion, they sometimes go hand in hand. So if it is a Bankart's lesion, okay, then we can very well repair it with the arthroscopic procedure where the sutures are put and this lesion is the gap is closed. Another indication for shoulder arthroscopy is removal of the loose bodies. Sometimes we find loose bodies which may be due to various pathologies, okay, and which may lead to pain, swelling, again limitation of movement for the patient. Okay, in this case, we need not open the shoulder joint as whole. We can just introduce our arthroscope and remove these loose bodies one by one. Then it can also be used, this procedure can also be used for subacromial decompression. Okay. Sometimes there's a bony spur or the osteophyte formation is there. As you can see in this diagram, there's a osteophyte formation under the acromion process and which may lead to impingement syndrome. Okay. Or limitation of shoulder movements and pain for the patient. Here again, with the introduction of our instruments arthroscopically with small portals, okay, we can, I mean, shave off this osteophyte and relieve the symptoms. Then come the AC joint pathologies, acromioclavicular joint pathologies. Again, as I told you, I mean, like the subacromial discompression, it can also be used for pathology of the acromioclavicular joint. Okay, it can use for repair of acromioclavicular joint in case of subluxations of grade 1 or grade 2 lesions. Okay, again, it can be used in osteoarthritis of the shoulder joint, where one can use this procedure to remove the bony spur on the acromion. Okay, so basically, this is subacromial decompression or the AC joint decompression. Another indication can be distal clavicle resection. Okay, so suppose there is a old case of acromioclavicular dislocation, okay, where the joint is unstable, there's cosmetic deformity is there, and some instability or pain is there on movement, or especially on doing heavy activities. Okay, in this such cases, one can go for a arthroscopic removal of the clavicle, the lateral edge of the clavicle, as marked here in the white. You can see that area can be shaved off. Okay, so cosmetically it will make it better. In fact, we can then reposition it and pass in a screw also to fix that acromioclavicular dislocation. Okay, so this is another indication. Then one can use arthroscope to release a subscapular nerve. Okay, sometimes it is entrapped, as you can see here in the diagrammatic representation, how it is trapped between the spine of scapula. Okay, so here you see when it passes, it may be due to soft tissue edema, okay, or again maybe due to a osteophyte or a burr formation, there can be pressure on the suprascapular nerve. which may lead to pain in the scapular area. The whole of scapula usually pain. The patient comes to you with complaint of usually pain, and sometimes there is also swelling and inflammation in the region. Okay, so this procedure again can be used for decompression of the supraclavicular